Again, this is the ARC of Florida, putting on a presentation. It's advocacy meeting. We do this once a month, and this was great timing. We have a great guest here today, the person who probably knows how the system works and budget as good as anyone, Jim DeBogren. We always appreciate that he's always willing to help us out to explain a lot of the bills, especially the budget, to people. And we will be recording this, so it will be on the ARC of Florida YouTube channel for people to watch later. We understand that it's hard to break away during the day sometimes to do this. Just want to let you know that yesterday at 11:48, they put the budget on the table for a cooling off period. Jim, maybe the starting point is tell us what that means and where are we now with regard to the budget? Because we've been working on advocacy from before when session began, even when delegation meetings were starting. So tell us what that means when they put the budget on the table.
Okay, so well, first off, thanks for having me, and it's always a pleasure to visit with you all. The Florida Constitution requires what's called a 72-hour cooling off period, and so once before the legislature can vote on the budget, they have to distribute the proposed budget to all members of the legislature, the governor, and the judicial branch. And once that's done, it starts a clock. And as Alan said, that clock started at 11:48 a.m. yesterday, meaning that the earliest they can vote on the negotiated budget, which is called the conference report. In this instance, it's the conference report for House Bill 5001. The earliest they can vote on that would be Friday morning at 11:48 a.m. One other thing I'll mention about the conference report is a conference report cannot be amended. If either chapter wants to amend the budget, it blows the whole thing up and they have to start over. Can't do it. It's a rule. And I've only seen it happen once in my entire career, and that was before we had the 72-hour cooling off period. And I actually worked for the legislature then. We were able to cure the problem in about 15 minutes and reprint the bill, and they were able to take it.
Jim, let me ask a question. Let me ask a quick question.
Mm-hmm.
So to me, it seems like you're saying that what you're talking about today is the final budget, and the only thing that could change it is if a governor vetoes a line item at some point. Basically, what we have now is basically going to be the budget for the state of Florida.
Yep. We know what the budget is, and you're correct. The only changes to the budget will come during the governor's veto period, where the governor of the state of Florida has the opportunity to veto any particular line item. And when we get into this later, Alan, we're going to be talking about appropriations that are put in bills other than the General Appropriations Act, because there's some really big ticket items. He can veto those. Those are line item appropriations as well. He could veto those and leave the rest of the bill intact.
So Jim, when Senator President Pasadomo had the bill for Healthy Families bill, the 10% rate increase.
Yeah, Live Healthy.
That was a separate bill, but did it also appear in this budget too?
No, you will not see it in House Bill 5001. You will see it folded into the recurring base budget when they work on the budget for fiscal year 25-26, basically a year from now.
So I want to make that clear, because I've been getting calls saying, where's the 10%? I don't see it, I don't see it. The fact of the matter is, it's traveling independently as a bill, and it's over, and that bill happens to already be on the way to the governor.
Yep, that bill is available to be sent to the governor. It has not been sent last I checked, but I didn't check this morning. That was a couple of days ago, but I assume it still hasn't been sent. Yep.
And so now we're talking about the budget. Is there any part you want to start off talking about first?
Yeah, I what I can do is just kind of give a rundown of everything that's in it. And again, what I'm going to do, Alan, because there's so many big ticket items that are going to be of interest, I think, to different people on the call, I'll handle it all as one big. Because I mean, ultimately, regardless of where the appropriation appears, it does get folded into the agency's operating budget whenever they implement these bills. So I'll just do a quick rundown. I'll start with some of the bigger ticket items first. So as we were mentioning, there is a 10% rate increase for providers. This time it's not connected to DSP wages like they have in the past. And so so this will really help providers deal with inflationary pressures that aren't related to wages, you know, insurance, the electric bill, whatever. Those costs have gone up as well, and they've not been addressed in the past. There's $195.8 million. That's a 10% rate increase. In addition, this is not passed yet, but I'm going to go ahead and it's pretty much a done deal. It's Senate Bill 1758 by Senator Broder. The companion bill is House Bill 1271 by Representative Buchanan.
Can I interrupt you, Jim, real quick?
Sure, sure.
I just watched Representative Buchanan speak on the floor, and it passed unanimously in the House. They passed the Senate bill, so it is done.
Okay, it's ready to go to the governor then. That's a good update. So that's 38.9 million if you're rounding. Other wait list money, there's just the kind of the traditional wait list funding they do for crisis and foster kids who are aging out. That's a total of $64.8 million. Representative Fine and added an amendment on the House version of the bill that we were just talking about that would provide funding to enroll people who are on the waiver who have a brother or sister that's also on the waiting list. He put an amendment on that bill to provide funding for those people. So if a household had, say, a brother and a sister, and they both have an intellectual or developmental disability, and they're on the waiting list, this is, it was designed to take them off of the waiting list. Since they passed the Senate version of the bill, they actually included the funding that Representative Fine had proposed. They included it in the budget. So that's a total of $16.7 million. And that's going to go to people in categories 3, 4, 5, and 6. So that's going all the way. Basically, the only category that would be left out is category 7, which are school-age children. Also, just to mention the 38.9 that I mentioned that's included in Senate Bill 1758, that is specifically directed towards the priority categories 3, 4, and 5, which goes beyond what the legislature typically funds, which is just categories 1 and 2, which is crisis and foster kids. Now, the other thing that's notable, and we can talk a little bit more about these substantive bills later, but one thing I want to mention, the bill that just passed the House floor, it lowers the age of the caregiver so category 4, let me just start over. Today, category 4 is people who are on the waiting list whose caregiver is age 70 or above. This bill is going to amend that to age 60 and above. And then these funds is $38.9 million. That's going to 3, 4, and 5. And so we're going to see an expanded pool of people due to that change in law, reducing the age threshold down to age 60. You total everything up. So, oh, and then one other thing, there is a managed care pilot project that has been that was authorized last session. It is directed to people on the waiting list or the pre-enrollment list. That's an additional $38.4 million in the budget for that. So if you add all of these together, all 4 waiting list funding provisions, both in the budget and in the substantive bills, you've got $158.7 million total for the wait list to help people get off the wait list.
Jim,
Yes.
just want to reference, because I know a lot of people are listening and they're wondering about their community. The pilot money, the managed care pilot, is for people to voluntarily don't decide not to do the I budget, but they're going to do the managed care pilot, which combines it with Medicaid and some other things. So they've created that opportunity. And I think it's about 910 spots for individuals, and that involves 610 clients from Miami-Dade and Monroe County, which is one of the regions, one of the Medicaid regions, and then the other one is Hillsborough, Polk, Manatee, Hardy, Highlands, in the county that has Arcadia. I can't remember the name of the county.
And I'm trying to think of the name of that county.
DeSoto.
DeSoto.
Thank you.
And I think I think the thing that's really clear, because we've been watching this, me and you, Jim, we've done presentations on this, is the wait list has always been the homeless, the crisis, the 1 and 2. And it was basically a wash, but for the first time, and you heard it from the speeches from Chair Fine, that they want to get these other people off that have always been waiting there. And I think that's a big deal, and including Representative Fine's commitment to sibling groups. So if you have a sibling with a disability, that can get you up on the from the wait list also.
Yeah, and I think that's what's notable. This is really, these dollars are targeting those people that get on the wait list and they stay on it for years and years and years. I mean, even decades in some instances, because the money always runs out before they get to these folks. So this is targeted to a whole different group of people than what we normally see, and that's that's a very positive development. So we've already mentioned the 10% provider rate increase. That the total funding there is $195.8 million. So good stuff there. Just a couple of other items that folks may be interested in. There is funding basically to do an actuarial analysis for a new adult pathways waiver. This is another, this would be a new waiver. It's would have a capped spending amount. It kind of reminds me of the old FSL waiver, Tier 4, in that I believe the service array will be limited. It's largely going to be, my understanding is that that waiver will largely be aimed at young adults who are transitioning out of the school system. For those of you that are that are fans or not of the iConnect system, there's dollars to continue that, but there's $1 million to hire an independent company to study the iConnect system, look at the performance issues that the provider community has brought to policymakers' attention, and those results are supposed to independently be reported to legislative leadership. Maybe most important, and I apologize for the wild animals in the background, but probably most notable, it basically directs the agency not to get recoupments from providers or to monitor provider compliance during the fiscal year. So hopefully that gives all parties involved a chance to step back, take a look, and have a good plan going forward. There are dollars for a new incident management system. This would allow basically APD to cross-check say emergency room claims or perhaps the abuse registry to detect potential unreported incidents. There's funding for a dually diagnosed program. They actually expanded that. That's in place. I believe they're adding Leon and Hillsborough counties to it. Alan, you might be able to chime in here, but that expansion, they're providing $6.5 million.
That is true. They're adding the 2 counties, so that's good. And there was also some ADT language. They're going to study that, and families are going to be interested in that because they know that the adult day trainings run deficits, and a lot of it is because they bill by the quarter hour, and it's hard to staff a place that bills by the quarter hour when you have to have your staff there, whether someone leaves early or not. So they're actually asking APD to look at that issue to see if they could bill monthly or daily or whatever.
Right, that's in proviso in the Agency for Healthcare Administration. Now this isn't a new item, but I think it's worth mentioning. There's $11.5 million in the budget for dental services contract. That's combining the $3 million that for the program that the ARC of Florida used to operate with another $8 million. The agency is allowed to use these funds to provide dental services directly in the event that they're unable to competitively procure a contract. And then, yes, I was going to mention the language that directs ACA to develop a report proposing alternative reimbursement methodologies for adult day training. That would include the option of monthly payments. There are a couple of sections that we see most years. Legislature, if there are surplus iBudget waiver funds, which it looks like there will be again, legislature would reappropriate those into a lump sum in the agency for persons with disabilities, and they provide similar reappropriation for dollars that are associated with a couple of IT projects. Alan, if you want to stop me here for questions, there were 3 substantive bills I was going to mention, and then I was going to open it up for questions, but I can pause right now if you think that.
Let's before you pause, I know there are a lot of individual projects out there, that local projects. Can you explain how that works? We're not going to go through them all. I'm going to send out the budget to everyone that was on this call, and they can look who got money and who didn't get money. But a lot of providers, some providers will hire lobbyists and they'll pursue local projects. Can you talk a little about how that works?
Yeah, the way these are dollars. There's actually in the House and Senate rules, there is a definition of an appropriation project. And essentially that definition is if it serves a locally identified area, or if the provider is identified in proviso, then it's an appropriations project. So that the organization that wants to get a project, they have to go find a sponsor. There's a form they fill out. The funding has to be non-recurring. And yeah, there were a handful of our art chapters. Alan, I did a list of at least the ones I could identify. We had several art chapters who got funding for different things. All of these are individual line item appropriations, and they're scattered all over the budget, not just in our area, but from section 1 through section 7. You have these local projects that are identified in proviso. Those are typically scrutinized just a lot of times they're scrutinized more heavily when the governor goes to decide what projects to approve and which to veto. We do have a handful, but that's pretty much that process.
Yeah.
And
And oftentimes that will be the thing that brings the budget together, because the House and Senate may have different issues, and you hear the word sprinkle sometimes. Sometimes that's closing the deal to make it all come together when people know of issues in their community. It could be a shelter, a hurricane shelter, it could be something else. And they kind of accept each other's outliers, budget issues. And I always feel that's the thing that helps. Because remember, the only bill they have to pass each year is the budget. And to get all those people on the same page, it causes a lot of compromise to occur. And I think the sprinkles, when they get to open up to each other and talk about their own individual challenges in their community.
yeah,
We got some questions, Jim. You want me to go through them?
yeah. Why don't we do that, because I think they're related to what we've already discussed.
Yeah.
Yeah, let's do that.
The first question is, are support coordinators included in the 10% increase, and when does that increase take place?
Okay, my interpretation is yes, because it is a 10% uniform across the board. They didn't exempt any service, and the 195 million, if you just do the math, I mean, they multiplied 10% times the entire waiver, and so my interpretation, and I mean, APD is ultimately APD/ACA are ultimately in charge of implementing this, but I think it's pretty clear that the intent, and I'm pretty confident the actual implementation will include the support coordinators, and the funding is provided effective July 1st, which is the start of the new fiscal year.
Yeah, and remember that waiver support coordinators, because I know that they've had a struggle bringing them in, and you need a waiver support coordinator to be able to get on the waiver. That last year, that they were the only provider, I believe, that got the 10%. And so this is the second year in a row with the 10%.
Right, right.
The second question is category 6 and above. Is this the only for siblings to someone on APD in all 6 and above?
Yeah, and again, the language that's associated with it is they talk about 3, 4, 5, and 6. So if you have it's pretty much everybody on the wait list except for the people that kind of get automatically enrolled off the wait list. That's categories 1 and 2. So categories 3, 4, and 5, and that's pretty much anybody on the wait list that is an adult. So category 7 is the only category that's not covered, and that's and that's children or young people who are who are at least eligible to receive services through the school system under the IDEA Act.
There's another question. Can you repeat the proposed change to category 4 age of caregiver? That's what went from 70 to 60.
Yes, so today, if a person is living with a caregiver who is age 70 or above, they're in category 4. Otherwise, they're going to be in category 6 or 7. What this is changing is category 4 now is going to start when the caregiver reaches age 60. So that's going to increase the number of individuals who are going to be in priority category 4 versus categories, well, likely 6 or 7. So that's that. Is there a way to get rental? And I'm actually seeing them now on the. Is there a way to get rental assistance for supported living clients? We've been priced out of the market, especially. You know what? Let me, Kim. The short answer is, yeah, of course, Section 8 is one of the key. Is one of the key sources, but rather than answer this off the top of my head, unless there's someone else on the call that happens to be, I would like to research that a little bit. And Alan, maybe we can
Okay.
we have her contact information and get
Yes.
a good answer.
Yes. And more clarification on the new pathways waiver for young adults. You're not going to see that this next year. They're just looking at it, doing a study. That's the goal, is to pay for a study. So probably next year you'll be seeing a report on what that new pathways waiver would look like, because they would have to make an application to CMS and CMS would have to approve it. But any insights into the new pathways waiver that you talked about before, Jim?
Nothing other than it looks to me like it's mainly aimed at young adults who are transitioning out of the school system. So
Like 18 to 22?
yeah. So in other words, whenever they hit age 23, then that's when a lot of people just drop off a cliff. They go from having access to services to nothing at all. So it's my understanding is it's going to be primarily targeted towards those individuals, but there's not enough detail associated with this to know exactly what. I mean, this is one we're going to need to keep monitoring. Like Alan said, there are a lot of questions that we'll learn the answer to as APD moves forward and starts to develop an actual proposal.
Another question from Christopher: will the private duty nursing rate increase only be 10% then? If so, this will no way solve the problem.
Yes, I think it's going to be 10%, but it seemed like they're.
Yeah. Senator Pasadomo in our Healthy Lives legislation had a lot of stuff regarding the nursing home shortage. So I think they approached it from many angles.
Yeah, that is actually a good question, and I know what's in the APD budget, and it doesn't have anything other than just the 10%, but I believe there might be some other provisions that would bump private duty nursing a little more.
Let's do this. I mean, I noticed 3 substantive bills that really impact people. I mean, there were a lot beginning in the session, but it seems like 3 of the bills crossed the finish line.
Yep.
So maybe we could talk about them. Do you have one in mind you want to speak about first?
Yeah, in fact, let's start with the one that included the wait list funding, which, as you said, it just passed off the floor of the House. So it's going to go to the governor, and in addition to the wait list funding and the changes to category 4, basically increasing the size of that group, there's some other provisions in that. This was kind of the APD bill this session. First off, it directs the APD to offer care navigation services. I think this is probably, they're thinking the Hope Navigators. That's a big push by the First Lady and several of the human services departments in state government. There are requirements that IEP plans be integrated a little better. Probably one of the, and this is honestly, I think a no-brainer that I'm glad they got around to doing finally. It introduces a requirement that APD provide the ability for people to apply for services online. And once they've applied, then it revises some of the timelines that APD has to respond to those applications, and it tightens that up, and particularly when there's a crisis. It also requires the agent, if the agency denies an application, they have to explain why. It transfers. There's a Florida Unique Abilities Partner Program, which is now in the Department of Commerce. That's going to get transferred to the Agency for Persons with Disabilities, and it mandates a report. So there, and then, as I said before, this provides the direction and the authority for APD to pursue the new home and community-based services waiver, the adult pathways waiver. There's just going on to the other two I had. There's one.
Can I make a mention real quick before we go to the other two?
Yeah.
First of all, I think the future looks really good. Remember, the sponsors of this bill was Senator Berger, and he'll be around for a while, and also Representative Buchanan, who's become a real champion of persons with intellectual developmental disabilities. But I really want to say that the upcoming leadership and Speaker Perez and Senator Albritton, President Albritton, I mean, I feel like we're just beginning to take on this wait list completely, and also the workforce issues. I see really good times ahead, but I also wanted to mention Stephanie Norden, who was the one that brought a lot of these issues to Senator Pasadomo and some of the representatives with regard to like an electronic, about what a crisis really means. And also JJ, who's probably been the most impactful advocate out there, not a lobbyist, just a person with cerebral palsy that wants to fight for everybody. Him and his mother, Allison, did a really good job, not just this year, but last year. And I think we all kind of relied on them. And I think it makes a big point that we need to always have out there that our self-advocates and our families are leading the way. We may have a lot of people that are fighting for it, but in reality, the self-advocates and the stories they tell and the families that they tell make the biggest difference. The next bill, House Bill 73, supported decision-making. How about that one? Was that your second one?
That was one of my three. That is a long time coming, and that is it. That one has made it past the finish line. It passed. It's ready to go to the governor, and Olivia Babbis is someone that comes to mind when I think about this bill. She's been working on it for years. But this provides some options for people to get assistance in making decisions without giving up their status as an autonomous adult. So this idea has been around a long time. It was being discussed back when I was the APD director, which was over 10 years ago now. So sometimes these good ideas take a while.
And that one was 4 years in the making, and it was very emotional to hear Michael, who spoke at that at the committee meeting. It was actually brought on the floor when they passed it, but he was the first person in Florida that Disability Rights Florida advocated for and won a case where he was allowed to use supported decision making. So it's in the end, it always comes back to the stories. I know Representative Tant and Representative Coster both told stories and why they took this on this year. And on the Senate side, it was our local senator, Senator
Corey Simon.
Corey Simon, whose wife is a special ed teacher. So these are more people that are going to be around a while. So that's why I say the prognosis is looking good. And that will be in effect July 1, 2024. And
Yep.
the ARC, and I'm sure Disability Rights Florida will be doing lots of training on this, so people are prepared. But I like the fact that judges can't find a guardianship unless they determine that a supportive decision making can't be there in its place. I think that's a really good thing. So I'm curious, which is the third one that you were going to talk about, Jim?
The third one I was going to talk about is I was going to talk about the transportation
Okay.
disadvantage. And again, that just it looks like they're just trying to increase. At least it's going to increase the size of the commission. It's going to do some administrative things, but looks like it's going to try to improve the level of service, set standards for driver training, service, timeliness, it establishes a process to report and investigate adverse incidents that happen in paratransit. It requires reporting, whatnot. So it should, so those, again, that's one of the bills that I believe it has passed and it's ready to go to the governor as well. So
Yeah, it passed today too.
yeah, that's what I thought. I thought
Yeah,
it
so
was on the list, but
and there were other bills out there, and like there was a bill, on employment of individuals with disabilities that dealt with the Employment First Act, but it's more just a reporting bill where people have to report what's going on so they can see what's happening with hiring people with intellectual and developmental disabilities. And but the three bills that you identified were the key bills. There's another question that came in. Denise asked that she wants a clarification. Category 6 includes clients 21 and older, but you must be a sibling, question mark. If you don't have a family member, it will not include you.
in terms of that funding, that that extra 16 million or so that got added to the budget as part of the so-called sprinkle list. So it's the very last thing that they did. The way that the language reads is, in fact, if you'll let me see if I have the budget, because if I do, I can just read it to you because it's. Let's see here. I've got it right here. Okay, I'm going to read the language to you because that might be better than me trying to interpret. Okay, so the sum is 7.2 million from general revenue, 9.7 million of federal funds, is provided to the agency to expand the home and community-based services waiver by providing services to the greatest number of individuals permissible under the appropriation from pre-enrollment category 6 who have a sibling in pre-enrollment category 3, category 5, 4, category 5, or category 6. So that, you know what, I'm glad I read that to you because it's it's subtle, but it's a little different than what I explained. So this is to be able to enroll a person who's in category 6 if they have a brother or sister who is also on the waiting list in category 6, 5, 4, or 3. Again, the assumption behind this language is that if they're in category, if that sibling is in category 1 or 2, they're an automatic enroll as a crisis. So that's why they cut this off starting at category 3.
You know, I was thinking when I first started, and I think we're getting clarification having read it. I thought that if you were already on the waiver and you had a sibling, that they could get added to the waiver because the way they explained it on the, you know, in the committee was it's so overwhelming already that having another person with an intellectual developmental disability just adds to it. So I think there's going to be some interpretation of APD on how they do that.
Yeah, there are a handful, and I think that the person who sponsored this, Representative Fine, I think and again, this is self-advocates talking to the people that represent them. And I think, you know, probably a family came and said, hey, you know, I've got two, you know, I'm not only being a caregiver for one person, I'm being a caregiver for two, and it's just stretching us too thin. It's a hardship. And I think he recognized that. And I think anybody intuitively recognized that. Yep, I think there's going to have to be some interpretation, you know, because, okay, so what does that mean? If you have a sibling, if you're on category 6, you have a sibling on category 4, does this language means that both category 6 and category 4 get enrolled? I mean, there are a lot of, there are some implementation questions still. And I think I saw Ms. Rodriguez, Kaya Rodriguez had her hand up.
Hi.
Kaya,
Yes. Hi, how are you?
good to see you.
Good to see you. Sorry I've missed the last couple meetings. I've had all kinds of things going on in my life that are just getting in my way. I have a question. Are we going to send these minutes out to people who aren't
Yes.
on or okay? And another thing, what about the Disney thing? I think we need to give some scholarships to that because I can't afford to come in. I would love to be a part of this. I mean, it's just a true big total good thing, I think.
Okay,
More stuff happening.
Kaya, you know, the advocacy day at Disney is in September, and there'll be a process on depending on how much we get donated on how many scholarships we can give. But I know who you
Great.
are, I know where you are, so if an opportunity comes up, so I understand. You did get a T-shirt last year though, so
Yes,
that's
I did.
better
And
than
I got a
nothing.
bag too. Yes. I love it. I take it to physical therapy for my neck and back.
You would definitely add value if you showed up there because I can imagine you on the dance floor when we have the dance that night. So, and there was some other questions, Jim, in there. Uh, let me see. Just so you know, we will be putting this on YouTube so people can rewatch this. If you go to our YouTube channel, and that's probably the best way to do it because then you can watch it. If we have additional information, we can post it on the YouTube channel too. But I can send it out. I have everyone's name of people that registered here. But there's a couple more questions. We're down to a little while left. Jim, do you see some of the other questions on there that you want to take on?
Yeah, and if I missed one, you can, there's some comments. So new question, supported living rate is currently 8.4% than it was 21 years ago. Is there a chance the services that are running at such a deficit would receive more than 10%? Again, this is an implementation decision, but so I'm gonna, this is an educated guess, but given the way the legislature described this, it was a uniform rate increase. I don't think the intent was for one service to get, say, 15%, and then that be balanced off by another service getting 5%. I think the intent here is everybody gets 10%. If there's a need to focus on a service and provide additional funding, that's unfortunately probably going to be a next year kind of project. Ron Sharp from Panama City mentioned that category 4, 60 plus age on the wait list. APD provide numbers in our marketplace. So APD should be able to, Ron. If they're not, I would be very concerned. And frankly, you've heard me mention this before. I'm concerned about how people are categorized on the wait list anyway. For instance, I don't know that the agency is really capturing all the people that should be in category 5, which are the young adults who are transitioning off of out of the school system, because the funding was open to this category a few years back, and they only extended offers to 13 people statewide, and that's out of 22,000 on the waiting list. So that I think there is a legitimate concern as to whether APD is maintaining and is collecting the information. Now they're going to have a little bit of a challenge because right now their questionnaire, if you look at the questionnaire that they give people who, when they are accepted for service, they're identifying, it's designed to identify people 70 and above. So there's going to be a little challenge for APD to identify these people. That's a good question, Ron, and I mean, APD is where we would get the numbers. Let's just hope that they have the information to be able to give good numbers on that. Talking about, Denise asked, wow, what about the other 21 and older in Cat 5? Stay on the wait list. I'm hopeful that this is going to clear category 5. Again, my biggest concern is whether APD has captured the people. So in other words, they've gone and they've moved these people who are transition age, who are currently in category 7, are they getting moved to category 5 whenever they reach that age where they're transitioning out of the school system? That's a bigger concern to me right now than
Jim,
whether
if I could
are...
mention in Jacksonville, we've been really proactive when rumor started that we might see category 6 and above. And we went out, to the parents, to the school, get yourselves changed into category 5, because in the Jacksonville area, our 5 counties, we had 2 people in category 5, and that was just ridiculous. So here, I think families have to be proactive about requesting their change. Well, they have to be proactive in requesting, hey, I'm 60, now you need to move me, or is the onus on APD to make these changes?
Well, to me, I guess I'm going to opine a little bit. To me, the onus is on APD. I mean, they're the ones, they're the custodian of these pre-enrollment lists, and that's their job. However, if I were the parent, if I were a family member, because I would all of a sudden get swept up into category 4. I'd be picking up the phone and calling APD too. I wouldn't just assume that they're gonna do it. Now, your point's well taken about Category 5. In fact, this issue came to my attention the last time they cleared Category 5. It was 13 people, and one of our ARC chapters has a school in the Northeast region, St. Johns County, and it is a school, and that's all they serve are transitioning people, and not a one of them got a waiver offer then, and that's what led. I mean, that's kind of what opened my eyes a little bit. Yes,
Jim,
your points are very well taken.
Jim, I think what we've seen is a commitment from this legislative session and into the future that they do want to take care of the wait list. They do want to know the needs out there. And I know that a lot of families have given up or think the list is too long to even sign up. The ARC of Florida is expanding their awareness initiative from Be Prepared, Be Counted, Be Heard to Be Active. And we're going to be going out to different areas of the state that request it. And Ron Sharp's one of those areas, I know. In Brevard County, I saw Vanessa from Arca Space Coast in Jacksonville, that we're going to have events where we bring families together and talk about the benefits of being on the wait list and what's happening. Because we think the issue is there's no proactive engagement to these families to let them know, as Speaker Perez said, that there might be a life vest out there for you. There might be help. And although Representative Perez said he didn't get help, he is committed to helping families. So I can tell you right now, we're going to be making a big effort at the ARC of Florida. We have lots of partners that want to do this. And we're going to be out there showing people what they need to do to enroll and what the benefits of their to enroll. And I think it's going to be an important time this next year.
Yep, I think that's I think getting the word out is that's one of the best things that the ARC can do, and you're in a good position to help that, because if these families if they're not aware of these new resources, then they're not going to access them. So that's a good.
Denise, you had your hand up? You got your mute on? Are you good?
Yeah, I'm good. Thank you.
Okay, and I noticed a lot of people on the call. I didn't mention their names, but Margaret, Hebe, there's so many people out there that are advocating that you are making a difference. And even though you don't get recognized that often, but when you're meeting with policymakers, you're impacting them, and the storytelling is what is making this happen. Telling them what happened in your life during the process of applying for the waiver or any other concerns is the type of things that cause legislators to say, I'm going to make a difference. In fact, what you heard on the floor today from Representative Buchanan is, if you want to find your why, do a bill to help people with intellectual or developmental disabilities, because these are the people of no fault of their own are in a situation where they need help. So Jim, I appreciate you always being there for not just me, but anyone that wants help and information about persons with intellectual and developmental disabilities. So I just want to publicly again thank you for all you do. And I know you've got the Family Cafe coming up, so I wanted to give you an opportunity. I know you're the board chair of Family Cafe. Just wanted to give you a chance to say anything about that.
Well, I hope we see all of you. It's a terrific event. You get to meet a lot of good people, make new friends, reconnect with old friends, but we provide a lot of educational. We hopefully you leave there with some tools that you didn't come with to be a better advocate on behalf of yourself and or your family member. And that's I'm trying to think of the dates. I believe it is June the 14th. It's that weekend. I know I'm going to be flying from Washington, D.C. straight to Orlando for it. I've got conferences stacked up, but just hope to see everybody. It's in Orlando, a central part of the state. It's easy to get to. It's probably the biggest event of its kind. We had, I think, right at 13,000 participants last year, so it's a big deal. We take over the what used to be the old Peabody. It's the Hyatt now on International Drive. We take over it. We pretty much take over the Rosen property right across the street. So one of the fanciest hotels in Florida. It's ours for a weekend. So join us if you can.
Yeah, and I noticed Allison's on. Allison and JJ, thanks for all you did these last few years. I know that it's not far enough for you, but we still got work ahead. And thanks for inspiring me and so many others.
And inspiring the Senate President. Right.
Well, that's it. And everyone that was on will get a YouTube link to this presentation. And thanks for all that each of you are doing. It is making a difference.